Welcome to the Toward a Healthy Built Environment Training for Health Professionals series. We're excited to be introducing Jolene Lansdowne, a policy consultant at Population Health. Her presentation is entitled Working in Partnership.
Thank you. I'm going to start talking about partnership building. I'm going to do a bit of the theoretical framework type stuff, and then the several folks following me are going to really talk about partnership in action. So it all rolls together, and hopefully it all rolls together because we didn't coordinate, but here we go. To get started, working in partnership, as we heard this morning from Gary, there are so many opportunities to work in partnership, all sorts of different work, and kind of moving beyond the enforcement work of EHOs, but OCP reviews and participating in community engagement processes, on and on and on. There's a lot of partnership opportunity. There's a lot of opportunity to work with local governments, but I also want to acknowledge and say and remind that in moving this work forward, there are partnerships that we have across health authorities with other environmental health teams and health protection teams. This training is a perfect example, but also partnership within your health authority across departments, within your public health teams and beyond, with nonprofits that are in community that will be rolled into Healthy Communities work. So just looking at partnership beyond just partnership with local governments. And just to kind of set the stage and get a feel, and I can't see the folks in other rooms, but just a show of hands to kind of get a sense of who's here and how, what you do and how you feel about your work. Who is involved directly with the Healthy Communities, quote unquote, project type work? Okay, we've got excellent, a few people in this room. Who considers some of the work just partnership with local governments? Okay, I think maybe the same set of hands on that one. Who knows that some of their work involves partnership with other health authorities? Who has some of that going on? Excellent. And who already partners within their own health authority? And is there anybody in the room who feels like they just really don't do partnership work yet at this point? Getting there, going there? Nobody's willing to admit it? Okay, that's fine. So that's just to kind of acknowledge that really we're all already doing this work, and you're probably going to already know this. Maybe it's some frameworks you've seen before. Maybe it's something you've never stopped to think about, but you could say very quickly and intuitively in your current partnerships whether they are working and humming along and amazing, or whether they're really not working. Some, get stuck, there's conflict, there's lack of engagement, you feel like you're not achieving the things that you thought the partnership was about. And so this is just a bit of a step back, a bit of a framework to kind of help you maybe look at those partnerships in a different way, think about things that could help move them along more, or maybe identify that the wrong people are at the table, or you name it. So we will kind of dive in. I'm gonna walk through this whole framework. Okay, thank you. I'm gonna walk through this whole framework. There's a lot to it. There's a lot of different concepts in there. I don't want to get too hung up on exact language, because you'll hear partnership and collaboration and cooperation and all of these words interchanged along the way. I really wanted to just look at the concepts. There's a lot to this: the trust, the turf, the loose, the tight. So I'm gonna walk through all of it step by step. Get rid of it. Starting at competing, acknowledging that this, is, it's defined as competition for clients, for resources, for partners, for public attention, what have you. Likely the work that we do in partnership with others, our partners, we're probably not in competition with them, so that's fine. But just to keep in mind that if you're in a large group with multi-stakeholders, that some of those stakeholders in the room might actually be in competition with each other, whether it's local nonprofits or other community groups. So just keeping that in mind as something that might be happening in the dynamics of the room. This next one, just coexisting in community. There's a lot of us doing a lot of different work out there around healthy communities. And It could be that there's just no connection between us, other agencies. Some people might use the word silos here. So just kind of humming along and not paying attention to each other. The next one, this is where I would say we really start to talk about partnering. And so communicating, interagency sharing of information. Some people use the word networking here. And so this is something my guess is you're going to all be familiar with. It can happen informally or formally. You know, it might just be one-on-one relationships you have with another EHO at another health authority, or that planner that you already know in the community. It can happen at every level. So from senior leadership down to frontline, or it may be formal. So there might be formal partnership tables, and the goal of those tables is simply around information sharing. For example, there might be local healthy communities table that have many different local governments at one table, and it is just simply about information sharing across local governments around certain topics, just sharing best practices and lessons learned. Next one, cooperating. So this is where we start to get a little bit more involved with each other. And this is, so as needed, often informal, doesn't need to be, interaction on discrete activities or projects. So these are one-offs, and you can probably think of many where you participated in just a discrete project, whether it be a document review or a health forum, or one-time grant that happened that you came together and did a project. So these are discrete projects, and when they're done, you're done talking to each other less and more around that project. It can happen across health authorities. This training is a perfect example. A one-time project, come together, spend some time cooperating, and then the project is done. The who is involved is usually as you move along this continuum into things like cooperating, coordinating, it might not just be frontline. So you start to, managers are involved, or at least aware and approving of this level of engagement. It might still just happen at the front line, but there's more engagement at the upper levels. And things like this, you might have a few more tools, a few more meetings, and structures around the process. Next one, coordinating. So this is where agencies systematically adjust and align the work with each other for greater outcomes. And so this is, I would say, again, more commitment, more forward-looking. So this acknowledgement that you want to keep working together into the future, and you start planning ahead around the work that's coming up. And so looking ahead with a local government and all the activities that they might have in the coming year or two. And so planning for OCP review, or a neighborhood plan, or community engagement processes that are coming up. And we start to coordinate our agendas to match their agendas. And we start looking forward a bit more. It could be coordinating services as well, around if somebody else is providing a service or running an event, we're not going to do the same thing. We're going to coordinate and maybe do something that builds upon that as opposed to repeats it. So that kind of thing. We're talking more often. We know what each other is up to, and we're starting to plan our own agendas around other things that are happening for our other partners. Again, this is where you will have more of your team involved, your managers involved, senior leadership involved. Next one, the truly quote-unquote collaborating portion of this spectrum. Again, people are going to use different language for this, whether this is someone's definition of partnership or collaboration. But this is really that longer-term interaction based on shared mission, goals, decision-making, resources, So this is truly planning together and coming together around a common vision. Just to note though that this doesn't require common activities. So I think that's just something really important to point out. So when we come together around visions for healthy communities, and whether it's looking at safer, secure housing, the role and activities that we take on are going to be different than the local government, are going to be different from BC Housing, but we are all still talking to each other, collaborating, and moving towards shared goals that we've identified together. One model that is commonly talked about in this one is collective impact model. I don't know if folks have heard that one buzzing around. It's something you can certainly look into. There's a lot of information out there. It's kind of a trendy model right now, and it is really around intensive collaboration and commitment to shared goals, but shared measures. There's a strong coordination role, strong communication as well. So that's just a model I would recommend you looking up if you're interested in kind of reading a bit more about that. At this level, you certainly need leadership, buy-in, commitment, participation to have this kind of work be solidified and really move forward. Everybody at every level needs to be committed to this, be understanding of this, and then to go forward and do the activities that actually feed into this. And then this final one, again, the far ends of the spectrum, we might not really find ourselves there. So fully integrating programs, planning, funding, this might not be something that we do with any of our partners, but it might be something that we see some of our key partners do, like local nonprofits, that kind of thing. So really kind of like merging. So that's the spread of levels of partnership, if that's what you'd like to call it. And then layered on top of this, we've got the triangles. So there's the trust triangle. And this is, you notice kind of as it goes along the spectrum, it gets larger. And so really saying that as you move along this continuum, you're going to need more trust to go from something that's just simple information sharing to shared decision making and goal setting. So trust, relationship building, you can tie time into that because it takes time to build those relationships. On the bottom triangle, we've got turf. So this is when we talk about, we've got a bunch of different agencies and organizations coming together, and we've all got our own turf. We've all got our own established mandates and missions and visions and that kind of thing. But the closer we work in partnership, the more we might need to just let go of that a little. And that's why the triangle for turf gets smaller. And so we're coming together to have shared goal setting, vision, mission. We might need to loosen up a little and let go of the ones that we come in the door with from our own organizations. And even just mentioned earlier, I think both from Gary and Pam, we might need to loosen up on our own jargon and our own language and our own acronyms. So our own turf that we know and love and it's embedded, we might need to loosen that up as well. So that's that. And the last piece of this framework is this loose, tight continuum along the bottom. And this is really about coordination, administration needed to make this stuff happen. And so things can be a bit looser if we're just talking about communicating, coexisting. Doesn't need a lot of structure, doesn't need a lot of coordination. Sure, there might be a regular meeting schedule, a networking meeting. Might not happen very often, but they're scheduled, they're in your calendar, you know when they're going to happen. But as we move into shared projects, cooperating around shared project or coordinating around our schedules, you're going to need to be in touch more often with folks. So just more regular meetings, face-to-face if you can have them. If not, over the phone, fantastic. And then things like collaboration, there's a lot more tighter structure to that around actual well, one, you might have terms of reference. So supporting documents that define expectations in the partnership, and then you've got listed goals and outcomes and indicators and measures and all of those things. So that's kind of the loose, tight continuum. Really important to mention is that the goal is not to move from one side to the other. So that's not the goal. It's not the goal to take every partnership that you're working in from communicating to collaborating. The goal is to have your partnership working at whatever level is important for what you want to achieve. And in some cases, all you want to achieve is sharing information. That is key. That is key to moving your own work forward and everybody else's work. So the goal is not to move along the continuum, just to really keep that in mind. And though I will say, if you are in a collaboration, if you're in a really effective collaboration, likely you have moved along this continuum because it's taken time to really get there. It's taken time to build those relationships, to build that trust, to test each other out with just some information sharing first, and then maybe we'll try one discrete project together, and then maybe we've built this trust and understanding that we can move to collaboration. So if you get there, you've likely moved there along the continuum. All right, so what are we really trying to do together? I hope that framework kind of makes it clear that partnership isn't just like the stab in the dark, and it's not just, yeah, we do partnership. Like, it's way more nuanced than that, just than saying, yeah, we work in partnership with everybody. That's how we do our work. Maybe, but there's like way more nuanced detail to it than that. And so in describing the partnership work maybe a bit more clearly or more fully, or deciding what to do, the considerations in doing that. So, I mean, first and foremost, with anything we do, I hope you're thinking about your intended outcomes. So what is the purpose of whatever it is you're doing? What is the purpose of the partnership? And just taking time to really think about that, and what do you need? So is it truly just about information sharing or lessons learned, or do you want a bunch of different stakeholders to come together around a common issue in community, safe housing or active transportation, and is the goal to like really collaborate around this issue? So looking at that intended outcome, starting there always. Other considerations. Readiness of your partners, right? And readiness, you can't force this, unfortunately, as much as we might like to. Readiness really is both around the trust and the turf, right? So is there enough trust there? Are folks ready in that regard? And are folks ready to give up turf if needed or not? And really just being honest about where each other is at around those two pieces. And then commitment levels of partners. And this is a little bit different. So even if the readiness is there, and it might really be there, everybody's excited about collaborating, but for many reasons, it might not be able to be the priority at this point in time. And if the commitment level just can't be there right now, acknowledge that as well, and keep talking, keep in touch, keep networking, keep checking back in until everybody's commitment level can be at the point to move something to collaboration. And I think it's really important piece of effective partnership to have equal commitment from your partners. But I think it's really important to make the distinction between equal commitment and equal contribution, because everybody's contribution is going to be different. It's going to fluctuate in some points in a project or some parts in a collaboration. You'll be giving less or more, but you're all still equally committed to moving something forward. And so there's really a distinction there. And this is so obvious, but I'm going to say it anyway, is in any work we do, we really need to think about our own time and resources, our partners' time and resources, skills, capacity, like tag it on there. And especially as you move partnership work along, it requires a bit more time and commitment and coordination. And so just really being clear ahead of time whether it's there or not. Because, I mean, all of this, I guess, is a really a subtle way of saying be realistic. And this idea of don't overpromise and underdeliver partnership. I mean, it's a good rule of thumb anywhere, but I think especially in partnership, because nobody's going to feel good, and you can really lose appetite for partnership if it's not working. So if the resources weren't there, the commitment level wasn't there, the readiness wasn't there, but the talk was there, we're going to do amazing things, and we're going to collaborate, and we're going to change the world, and then they're just because of those things, you couldn't see movement, and it's really going to kind of sour people's appetite to this idea of working in partnership. So big, bold, neon flashing lights, be realistic around partnership. And we heard it this morning too, that all of this work takes time, that all of this work takes relationship building and respect building, all of those things. And I think this just connects to that really, really closely. Next slide. So how do we work in partnership? So we've defined what level of partnership we want to work at, and we're excited about it. But so what are some of the things that are going to help move this work along? I usually do a much more engaging process. So I want to ask the audience. Any ideas? What are things that help partnership be effective? Just shout it, because somebody's got a big voice out there. What's good for partnership? I'm sorry, I can't even see the other rooms to see if you're raising your hands.
Listen to people.
Listen. Okay, awesome.
Show up.
Show up.
Face to face.
Face to face. Anybody else? Okay, so we just got to show up and we listen to each other, and we're like, got it done.
Be respectful.
Be respectful. Okay, awesome. Well,
empathetic.
Apathetic.
No, not apathetic. Empathetic.
Okay. We're on the same page.
Okay.
Okay, so everything, this actually goes well with this little presentation. Everything everybody just mentioned to me rolls into my first point, which is, how are we going to do this? We need trusting relationships. This is foundational. If we don't respect and trust each other, the rest is just really, really difficult. Pam said it, get out from behind your desk in whatever way you can, whether it's face-to-face or just make a phone call. Go for the casual coffee meeting first. Just get to know each other, build these relationships. But folks who didn't raise their hands with any more ideas, this is not enough. So to have a room full of people who are really amazing and really talented and trust and respect each other does not actually mean work is going to get done. So that's just not quite enough. I would suggest you need a bit of a plan beyond that. And so some other key pieces to successful partnership are common understanding of why you're in that room. So first and foremost, common understanding of your purpose, right? And be explicit about it. State it out loud. Make sure everybody's on the same page. So if it's just, yeah, we're all getting together because we've got some really cool lessons learned about this new policy that we've all had to roll out, and let's just make sure we're sharing so we're not duplicating. Awesome. Everybody's on the same page. If you've agreed that it's about collaborating, you're going to need to move to some of those other common things like goals and measures, etc. So you might not need to move there if it's a really basic partnership, but you're going to want to move to common goals, to common measures, common communication practices, and be really explicit about those with everyone. Next one. Once you've decided what you're all getting together for, Common understanding of each other's roles and expectations is really, really, really important, because this is when people can get frustrated with partnership work, when you have expectations of each other that are not clear, and somebody's not stepping up the way you thought they were, or delivering the way you thought was expected. So this is just really, really helpful to keeping everybody happy. And for you to know what others expect of you, right? It's much easier for you to show up and be confident in your partnership work if you have been clear around what you can bring and the expectations of the group for you. Next one, clear, continuous communication, on, and connect, and talk, and repeat, and make sure that everyone feels in the loop and everyone's on the same page. And that only happens if you're talking about it, if you're putting in documents, if necessary, in emails. And also, we're all just busy and we forget. So just take time to reach out and communicate and connect. And that is this last one, which is, I would say really important to partnerships being successful is just simply persistence, especially when it's partnership outside your own office, because we all are really busy. We've all got other work, other commitments, other teams we're working with, other organizations, and so it's an out of sight, out of mind piece sometimes, but and it's going to ebb and flow, right? It's going to ebb and flow depending on staff changes at a different organization, or different mandate that came through, or a new pot of funding that came through, or whatever it is. This changes all the time, and it's going to ebb and flow. But as much as you can, maintain those meetings that normally happen, maintain those relationships as best as you can, because it's going to be required to move some of this big picture work, especially around healthy built environment. That's big, that's long term, and so this partnership work just needs to be this common thing that's happening in the background all the time. I would say a couple of keywords that kind of layer across all of this are patience, we heard that this morning, time, respect, transparency. To me, transparency is like a golden rule. Just, be clear, be honest, be transparent about your abilities, your knowledge, your intentions, and I mean it leads to respectful relationships if you can really be transparent and honest about why you're there and who you are. I'm going to talk about some of my lessons learned, and I do put the word many up there because there are many, because every partnership is different, every relationship is different, they're always changing, because partnership is about the individuals in the room, right? And it's always a different set of individuals in the room, and you're going to learn something different in every partnership that you work in. So, which is exciting and fun, and I really like to learn. So, partnership work is great for me. This one was really big. I learned this early on. Without involvement, there is no commitment. This is kind of foundational to community development work. You might hear about that tomorrow, or community engagement work as well. But I think there's an important distinction to make between involvement. So not everybody needs to be involved in every step, but there are some key steps where you really do need to make sure that all the partners are involved. And so things like coordination and setting up meetings, people are usually happy to get out of the way and let that happen, and that's okay, because not everybody needs to be involved in setting up meetings and writing meeting minutes and all of those things. But don't let people get out of the way when it comes to the true partnership work, whatever it is. So whether it's just information sharing and lessons learned, or it's about planning together, developing together, building projects together. Also, you don't let other people get out of the way, and don't get out of the way yourself. So we also heard that this morning, is always participate, right? Always contribute, always ask, even if it is just about asking questions. But everybody needs to be involved in order for there to be buy-in and commitment. And it can happen, especially if you're in a coordinating role, for people to say, yeah, go ahead, just move that forward, just go ahead. Or, don't take lack of opposition as actual endorsement. Those aren't the same things either. So if somebody's not raising their hand and saying, wait, I don't agree with it, it doesn't mean they actually do agree with it. And so we need to just really try to get people involved and participating as much as possible, because it can happen that a couple of your partners have said, go ahead, move it forward, we agree, fine, yeah, good, I don't have time to review that document or that idea that you're pitching. And then you get to the final project or product, and there's not a real commitment to what was produced. That's when you'll hear responses of, I don't agree with what this is. And so but there was months of opportunity for you to, and then, again, this impacts the momentum of partnership more than anything, right? So you get to this point where you thought you were partnering for 6 months and you did this great thing, and then wait a second, maybe that was really just my project, and we didn't build this real excitement of partnership together. So really, and if people aren't participating and there isn't involvement, this is your opportunity to take a step back and look at that framework and think about why that might be. So is it not the right folks in the room? Is it some people thought they were there for networking and some people thought they were there for project building together? Is it a turf or trust issue? If people aren't involved, is the trust not there? Are they not ready to give up turf? So start to kind of examine around issues for why people aren't involved. And if it's simply a time issue, slow down if you can. Slow down until you can get the involvement that you need. Too much structure too soon can stifle progress. So talking about things like really regular meetings or terms of reference that are 5 pages long and lay out every single principle of how we're going to work together. It's really hard to get people to do this if they don't know and trust and respect each other. And so it's really acknowledging what level of structure is needed for what level of partnership. So think about networking and communicating, and whether or not we need really rigid structures around that. And if you can loosen up around that, great. And again, that might be everybody loosening up on turf and expectations around how, well, at BCH, we usually do meetings like this, and at the city, we usually do. So loosening up around regular structures and just really finding the structures that work for the partnership work.